Hello, my name is Stephanie, and today I will be demonstrating tracheostomy care. I will enter my patient's room, close the door behind me to ensure patient privacy. I will perform hand hygiene. Hello, Mr. Johnson. My name is Stephanie, and I will be your nurse today. Can you please verify your first name, last name, and date of birth for me? All right, so I went ahead and verified using two patient identifiers. Today, we will be performing tracheostomy care on you. Is that okay? All right, so I will explain the procedure with duration, and I will ask if my patient has any questions. I will collect my supplies. They include a clean pair of gloves, a tracheostomy kit, a container for our normal saline, and I also have hand sanitizer. I will start off by checking the provider's orders in the EMR. I will assist the client in a semi-Fowler or Fowler position, and I will raise the bed to a comfortable height. I will make sure to assess my patient's vital signs, and I will make sure to apply an oximeter on my patient. I will suction the tracheostomy tube, and I will pre-oxygenate if needed. I will ask the patient to take a deep breath for me. All right, so I will perform hand hygiene. I will apply clean gloves. In a real world setting, I would ask a nurse or an NAP to help me with the procedure, and I would ask them to stabilize the trach so it doesn't dislodge or move. I will remove the oxygen source, and I will then remove the soiled tracheostomy dressing. I will remove and discard my gloves along with the dressing. I will perform hand hygiene. And now I will organize my supplies. I will open the tracheostomy kit with the sterile basins. When opening up the tracheostomy kit, I want to make sure to open it away from me. And I will now take out my sterile gloves. I will take out my sterile drape. I want to make sure that I only touch the Chinese side of my drape. And I will lay that down on the table here, flat. I will place these items in the center of the sterile drape. I will then fill my basins with the silky solution here and the sterile normal saline into separate containers. I will now apply my sterile gloves. I want to make sure that I am only touching the 1-inch outer border here. I want to make sure that the paper stays flat. All right, I will throw away this wrapping and I will organize my items here. I will place my Q-tip swabs in the saline here. I will next along the inner cannula, and I will gently pull it out here in line with my patient's curvature. I will place the inner cannula in the soaking solution. I will now clean the inner cannula by taking the brush here and using the normal saline to remove the crusty secretions. I will scrub inside and out until there are no more secretions left. I will throw away this brush. I will rinse the inner cannula and I will place it back into the normal saline. I will let that soak. I will pull it out. I will let it dry and I will place it back into the tray using my patient's curvature and I will lock it back into place. Next, I will clean the skin and around the phalanges. I will take a sterile applicator, Q-tip. I will clean around the incision. I will discard that. I will take another sterile applicator, Q-tip. And then I will clean the face plate and I will discard that. I will pick up another sterile applicator and I will clean around the trach and I will discard that. I will use a sterile normal saline again to remove any crusty secretions. I will then thoroughly dry my patient's skin and two phalanges using a dry gauze square. I will discard this. I will take this opportunity to inspect the area. I want to make sure there's no signs of infection or skin breakdown. I will replace the ties now. And I want to make sure that I'm stabilizing the cannula here as I'm doing that. So I will change the tracheostomy ties. At this point, I would ask another nurse or an NAP to hold the tube as I change the ties. I will discard this and I will change the ties using the 1 or 2 strip tie method. So I have grabbed a new tie here. And when I wrap the strip around my patient's neck, I want to make sure there are no twists or knots because this may cause skin irritation. I will continue here to tie the knot. I want to make sure the knot is not too tight here. I will insert 2 fingers here, make sure the knot is not too tight. And now I will place a new dressing. And I will take a folded 4x4 square, place it under the knot. I will use tape here. Make sure that the tape does not touch the patient's skin. Do the same to the other side. And do the same with the tape. Now that I'm finished with my scale here, I will discard all of my supplies. Take off my gloves here. Make sure my patient is in a comfortable position. And I will lower the bed to a comfortable height here. And Mr. Johnson, is there anything else that I can do for you, or do you have any questions? All right, sounds good. So my patient is doing well and in a comfortable position. I will leave the call light here within reach. I will now exit the room, perform hand hygiene, and I will go document my procedure.